Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, chart examples, ICD-10 tips, and more. Let's get started. Let's review the CPT codes used to report this service. 73120, radiologic examination hand, 2 views. 73130, radiologic examination hand, minimum of 3 views. These CPT codes are selected based on the documented number of views in the radiology report. Radiographs of the hand include a variety of views to assess trauma, degenerative changes, or post-surgical complications. Standard views, PA view, oblique view, lateral view, orthopedic views, AP ball catcher view, Nergard projection, used to detect early erosive arthritis. Bilateral PA view, commonly used in rheumatologic studies. Report example, order exam, hand 2 views, right header, PA and lateral views of the right hand. History, post-op, right middle finger complex nail bed repair, I&D, open reduction with suture, 1/5, 2023. Comparison, outside radiographs dated 12/31/2022. Findings, comminuted fracture of the long finger distal phalanx tuft with displaced fragments. Overlying soft tissue swelling and bandage material are present. No dislocation. Impression, long finger distal phalanx tuft comminuted fracture. Let's look at the views, PA view and lateral view. That's a total of 2 views. This qualifies for CPT code 73120, radiologic examination hand, 2 views. This is a post-surgical follow-up to assess healing status after repair of a traumatic injury. The fracture is described as comminuted, and although displacement is not explicitly stated, ICD-10 guidelines default to displaced if unspecified. Most appropriate ICD-10-CM code S62.6546D, displaced comminuted fracture of distal phalanx of right middle finger, subsequent encounter for routine healing. Correct codes for this case, CPT 73120, right radiologic examination hand, 2 views, and ICD-10-CM S62.654D, displaced comminuted fracture of distal phalanx of right middle finger, subsequent encounter. Report example, order exam, hand 3 views, left, header, PA oblique and lateral views of the left hand. History, left hand small finger spur removal. Comparison, 10/24/2022. Findings, interval removal of a small spur at the distal small finger amputation stump. Chronic post-traumatic and post-surgical changes were noted. Persistent radiopaque debris in the ring and middle fingers. Impression, revised amputation of the left small finger. Let's look at the views, PA view, lateral view, oblique view. That's a total of 3 views. This qualifies for CPT code 73130, radiologic examination hand, minimum of 3 views. This is a subsequent encounter after traumatic amputation of the small finger. The stump is still healing and shows post-surgical debris. Z codes for acquired absence are not appropriate until the amputation is healed and stable. Most appropriate ICD-10-CM code S68.112D, partial traumatic amputation of left little finger, subsequent encounter for routine healing. The history and radiographs support a trauma-related amputation with ongoing follow-up. D denotes the routine healing phase. Correct codes for this case, CPT 73130, left radiologic examination hand, 3+ views, and ICD-10-CM S68.112D, partial traumatic amputation of left little finger, subsequent encounter. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.